All right, hello everyone. Welcome to Dental Home Partnership Strategies for Success. My name is Christy Moore, and I am the Family to Family Health Information Center Program Lead with ECAC, and we thank you guys so much for joining us today. I would like to welcome our presenters, Ali Luna and Debbie Kruger from the Division of Child and Family Wellbeing, Whole Child Health section. That's still new to me, so I want to make sure that I say it right. We want to thank our interpreters from Full Circle Interpreting and the folks from Relay NC for closed captioning today. Thank you guys so much for joining us. So we're going to go ahead and get started. Just a couple of things real quick. Oh, and I do want to mention with Relay, you will hear our presenters state their name before they speak when we switch the slides, and that's so the captioners can tell who is speaking on what slide and can type that into the captions. We do welcome your questions, and as a matter of fact, we hope you have tons of them. But we would like to ask that if you can to wait, we have a designated Q&A time at the end of the session, and that's just to make sure the presenters can get through all the material they want to share with you. If you have a question, that you want, you need clarification on something, or you need to get something answered for understanding, but before you can move on and understand the rest of what's on a slide or in the presentation, feel free to type it in the chat. Maybe I can answer it. And if not, I'll ask Ali or Debbie to answer your question then, but we will have designated time at the end for most of the Q&A. Also, I will send out an email afterwards that will have a PDF of the slides. It will have the dental home checklist in English and in Spanish that Debbie and Ali are going to talk about today. And it will also have the recording link on there. So it'll take me a little bit to get the recording all set up. And then it'll also have another link to the evaluation. So with that, I would like to go ahead and turn it over to our presenters.
Wonderful. Thanks so much, Christy, and thanks again for having us. My name is Ali Luna. I am a family partner with the Whole Child Health section. I am a mom of 4 children, all of whom have varying special health care needs. Some of them include autism, rare brain malformation, chromosomal abnormalities, epilepsy, connective tissue disorders, etc. From experience, I truly understand the need for support, accommodations, and the need for consistently positive dental experiences. During this time together today, we want to share the strategies that can help you gain confidence in meeting your child's oral health care needs. And Debbie, if you'd like to introduce yourself.
Hello, my name is Debbie Kruger, and I'm a public health dental hygienist and the retired special care dentistry coordinator within the North Carolina Division of Public Health. I too have children with special health care needs, although they're adults now, but children with special health care needs become adults with special health care needs.
So true. Okay, so now we're going to move on to our objectives. I would just like to make note that since we will be providing closed captioning for today's session, you may hear us introduce ourselves when we switch from slide to slide occasionally. And that is just so we can make it more accessible for those reading the transcription. So our objectives today, we are going to discuss the importance of oral health care for children as a part of their whole health care. Ways that families can partner with dental providers to really promote a positive oral health experience. And we're going to go over some accommodations and strategies to support a quality dental home experience. So now you may be asking, what is a dental home, right? A medical home is your child's regular doctor from birth to adulthood who addresses their medical and healthcare needs all through their growth and development. Their medical home provides comprehensive care like well visit checkups, sick care, and referrals to other specialists or therapists if necessary. They often go by pediatricians, or it may be a family practice that you see, but it will be your regular doctor for the most part. We also encourage everyone to have a dental home. So that's a regular dentist who knows your child's oral health history and development, and they can make referrals to specialists like orthodontists or oral surgeons if necessary. Just as it's important to start taking your child early in their lives to a medical doctor, it's also important to start taking your child to their regular dentist. Ideally, this would be by their first birthday, but if you're past that point and still haven't established care, that's totally okay too. You'll just want to do so as soon as possible. The earlier you start having regular dental checkups twice a year becomes a natural, comfortable, and expected experience. But again, it's not too late, especially with this info that we're going to share. In both a medical home and a dental home, it really is vital that you feel comfortable sharing information about your child and also feel confident asking questions. And so today we're going to work to help build that relationship a bit. So now let's talk about oral health, what it is and what it looks like. It may surprise you to learn that tooth decay, which can also be called cavities, is the most common chronic disease amongst children. It's even 5 times more prevalent than asthma, which is pretty high up there.
This is Debbie. As noted, regular dental checkups are recommended twice a year. Many insurance companies cover regular dental checkups. For example, Medicaid and NC Health Choice have some of the best public dental health insurance programs in the country. If you have private dental insurance, we encourage you to take full advantage of the benefits that you have. Both the Academy of Pediatric Dentistry and the American Academy of Pediatrics both recommend brushing and cleaning between the teeth twice a day for 2 minutes. Fluoride is found in most public water supplies and more commonly in toothpaste. In fact, it's the only reason we use toothpaste. It helps protect the teeth from cavities. Fluoride protects the smooth surface of teeth, and the use of fluoride varnish is a great tool for preventing tooth decay as well. Fluoride varnish can be applied at your child's baby visits at the pediatrician's office, as well as at the dental office. You cannot get too much topical fluoride. Sealants are brushed on the teeth to protect the teeth from cavities and will last 8 to 10 years. Sealants protect the chewing surface of the teeth from decay and is a minimally invasive procedure, meaning there's no shots or drilling. Finally, it's important to avoid eating a high volume of foods and drinks with a high sugar content, since they put one at greater risk for cavities. Remember that even if your child is tube fed, oral health is important. Oral health refers to the health of the whole mouth, including gums, the lining of the mouth, the tongue, and the teeth. It's not just the absence of disease, but also describes how we use our mouth for daily functions that contribute to our individual health and well-being. We use our teeth for eating, talking, smiling, supporting our facial structures, and for social interaction and communication with others. Whatever enters our mouth may impact our overall body's health. For example, research has linked bacteria harbored in the mouth to infections that could potentially infect other organs and lead to long-term health conditions such as diabetes, cardiovascular disease, or liver disease. This is Debbie again. A child who's unable to chew due to chronic tooth pain may be less likely to eat enough nutrient-rich food for healthy growth and development. A child's speech development could be impacted due to chronic pain in moving the mouth or jaw. That chronic tooth pain can lead to difficulty in sleeping, which leads to irritability in younger children. In older children, the distraction caused by tooth pain can impact their concentration in school and at home, resulting in fatigue and sleep disruption. Ongoing tooth pain or untreated oral health issues can lead to missed learning opportunities caused by frequent absences from childcare or school. Parents may have to miss work if they need to care for their children or take them for extra dental appointments. Behavior concerns could result from reacting to pain or the frustrations of not being able to communicate. Finally, a poor oral health could affect a child's social development and self-esteem. A child who's embarrassed by the condition of their teeth or who is in ongoing pain may be less likely to interact with other children by avoiding talking, smiling, laughing, or even playing. Children with higher health needs may be at a greater risk for oral health concerns. If your child attends numerous medical visits and therapies regularly, it can be overwhelming to add yet another appointment to your calendar. It's not uncommon for parents to experience healthcare fatigue. But oral health is so very important, and poor oral health can have wide-ranging implications. Our aim is to try to share some important information to help foster positive dental care visits and to discuss strategies that could potentially address your child's specific needs. Furthermore, dental schools are now required to train their dentist on providing care to special needs patients. Dental schools from 2020 forward will have more training in the importance of a dental home, and we hope there'll be an increase in dental providers within your local area to provide quality, ongoing care to children with higher needs. Children with cognitive, sensory, or neuromuscular conditions may not be able to assume the responsibility and effectively conduct daily oral dental care practices like brushing their teeth for 2 minutes and cleaning between the teeth at least once a day. We'd like for you preferably to have that done before bed. Conditions like gastric reflux can make teeth sensitive or prone to enamel erosion. Children with compromised immunity or certain medical conditions like cardiac, kidney, or liver conditions may be more vulnerable to the effects of oral health diseases. Grinding teeth, also known as bruxism, can lead to dental challenges. Certain medications can also cause these challenges. For example, some medications can cause dry mouth. Saliva or spit helps digest food, protect teeth from decay, and prevent infection from controlling the bacteria in the mouth. Some medicines have a higher sugar content to increase the taste for the child. Some antibiotics like amoxicillin or tetracycline can impact the appearance of teeth. Diets restricted by texture or requiring soft foods or easier chewing of foods that are high in starch may lead to dental challenges. Even if a child is tube fed, you still need to brush their teeth daily. Children who do not get their daily nutrition orally still need to brush twice a day, along with visiting the dentist at least twice a year. Talk to your dentist if you have concerns about any of these issues and need strategies to address oral health or in the context of other specific health needs your child may have.
This is Allie. Debbie, I just want to add real quick that I'm so glad that you mentioned that a lot of parents or caregivers can have healthcare fatigue, right? So often we're running from medical appointment to medical appointment or therapy, and it just kind of feels like this revolving door. And so if there's not an issue that the child is not in pain, maybe we tend to think, well, we can put that off for a while. But it really is so important to have this preventative care so we avoid the complications and the potential health issues that may arise. So now we're going to take a look and we're going to have a conversation with you all so you can have a conversation with your dental provider and to make small considerations for adaptations within their practice, possibly to accommodate children with differing abilities. It's important to keep in mind that because of the pandemic and current COVID-19 practices, that may make some of these accommodations a little less available, but really it can vary from office to office. So it's probably worth the conversation between you and your provider. Okay. So here we have our dental home checklist, which was created by families and professionals, really for families. The checklist is not designed to be a report card or to grade a dental provider, but to be a tool to help collaborate with your dental team. For the sake of our presentation, we've grouped the checklist accommodations by category. So if you see the numbers on the screen jump around a little bit, that's why. Our categories we're going to discuss today are anxiety, communication, sensory, and mobility concerns. You may see the same strategy under multiple categories because it can be used as an effective intervention in several situations. Like Christy had mentioned, you're going to have access to your own copy, which will be emailed after our presentation. It can also be found at this link at the bottom of the slide, should you want to view it there. Okay, Let's start with anxiety. Who hasn't felt a little anxious going to the dentist? I know I have, even still as an adult sometimes, right? Um, in order to reduce anxiety, some offices provide a get to know me form that allows parents to share information about their child. This may include their child's likes and dislikes, triggers, or medical conditions. This information helps the provider prepare a comfortable environment to have a great experience. You know your child better than anyone, so take this opportunity to use a form like this to share information about your child's health needs and preferences, so that way the dental staff can make a positive impression on your child. And if they don't have one, you can always create one on your own to share with them. I know, especially with my children that have more intensive needs, I keep a blanket about me Google Doc on my computer that houses information like this, and it's usually well received. Sometimes having a provider take a minute on the front end to review this info can save tons of time in the long run. You can include things like your child's favorite cartoon character, an animal of interest, or maybe a movie they loved. Just a tidbit or two that the staff can maybe work into conversation and create a connection. Some dental providers may offer appointments during special scheduling blocks of time for higher needs patients. So also ask if this is available at the time of making the appointment. If these special blocks aren't available, maybe consider if your child has a peak time of the day. If they aren't morning people, you probably wouldn't want to schedule for the first appointment in the morning. If they've had a long and draining day at school, then maybe going late in the day after that might not be best, especially for those kids that tend to have meltdowns or have a lower threshold as their energy diminishes. Again, COVID-19 has changed so much. Some of the previous norms and routines, you know, if you haven't been there in a while, it may look different. So you'll probably want to ask if there are any changes to their office procedures before arriving at the office, so you can plan accordingly and let your child know if that would be of benefit to them. Some kids do better when prepped, whereas other kids not so much. But again, you know your child best. Some of the changes in these routines might be who can accompany the child into the exam area, having to wear masks, waiting in the car instead of in the waiting room, things like this. If your child has a comfort item like a stuffed animal or maybe a difficult to wash blanket, and the office will allow it into the exam area, you may want to consider placing it in a clear bag so the child can still use it. This would protect the item from airborne exposure, which can be helpful, especially if your child is, immunocompromised or something to that effect. That way you can just toss the bag away and then throw it out along with any germs that may have landed on it. I know one mom whose dentist was working hard to prevent their exam room from becoming contaminated and didn't feel comfortable with her child bringing in a large weighted blanket. Together, they came up with a solution of placing that blanket in a large, clear trash bag, and it worked out great. Sometimes sounds from other patients or tools in the distance can bring on anxiety. A self-contained exam room may be an option to minimize anxiety from these sounds. Allowing time for your child to get used to the exam room may be helpful. I know one of my kids in particular always has to do like a full scan of the room when entering somewhere new. It's like she takes a mental inventory of everything before she can actually relax. So if we didn't enter a few minutes before the dentist came in, she would be busy trying to look around, turning her head constantly while the dentist was trying to have her sit still and look in her mouth. So we try to get a little bit sooner in there. As noted, COVID has altered a lot of these routines. Staff will be wearing more layers of personal protective equipment. And so they may also be wearing it when they walk into the room, opposed to in the past where maybe they put on their mask after they've already said hello. That might be anxiety inducing for some kids. And so maybe consider finding a photo of the dentist and the staff on their website so your child can place a face with the person approaching them. Okay, so you'll want to let your dental care team know what techniques and tools work best for your child. One technique is the tell, show, do approach, which we'll actually get into a little bit later. A visual schedule may be helpful, or some assistive technology your child may use. And please know that it's appropriate to share concerns and ask questions, and this helps to build a mutual relationship of open dialogue. Your dental team wants to support you and your child with the shared goal of promoting your child's overall oral health. To further help your child to know what to expect during their dental visit, you might want to consider a book from your local library about going to the dentist. You could also develop a social story that portrays step-by-step dental exam process, or even take a photo of a family member during their visit. There are some videos online, but you'll want to be sure that you watch it yourself first. That way you can make sure it's about a positive experience, and to note if it's the appropriate amount of info to share with your child. Some like knowing all of the details. It leads to a sense of predictability. But some children do better knowing the minimum to avoid becoming upset or anxious when they overthink it. Sometimes too much information and over preparation, that itself could be anxiety inducing. So make sure to let the provider know which approach is best for your child. To help your child feel assured and confident, considering establishing a special code, a code word or hand signal between you and your child. That way, if they need a quick break or a pause, you can kind of speak up and interject and let the provider know. If you do not want to discuss dental treatment in front of your child, that would also be a way to communicate with the provider. You could also ask that they give you a phone call or email or mail information to you. If your child is very literal, you may want to help coach your dental team on how to pose questions. For instance, if they ask your child, do you want to sit in the chair? And the child says no, what then? Right? So a better way to phrase this question might be, which chair would you like to sit in? This way, the child feels that they have a choice or even a sense of control over their actions. Giving the child a choice and then honoring that really can help to build trust. We want to make sure that we're using friendly words like tickle, flutter, and clean, and maybe try to avoid words like scrape and drill. That can be somewhat anxiety invoking. Have the dental provider talk to your child using a friendly tone, a steady speed and volume, and in an age-appropriate manner for the most part, right? Some children may be uncomfortable or upset with an overly animated provider trying their best to convey friendliness. They may prefer a more direct approach, yet still in a friendly tone, of course. You know your child and how they'll best respond. So share those observations with your dental provider so they can mirror the best way to comfortably interact. I'll never forget one of my children. He was super young at the time. After a visit, he bluntly told me, I did not like that doctor. I'm never going in there again. And when I asked him why, he said, because he spoke to me like a child and it was very condescending. And after I was over the shock that he knew what the word condescending, right? I realized that it was because he felt like the doctor was speaking down to him. Some kids may find that comforting. I know another one of my kids probably would, but he didn't, right? So again, you know your child best, and don't be afraid to speak up and let the provider know this is what works for us. Showing visual aids can also help to offer some expectations of what will take place, which could possibly lessen anxiety.
This is Debbie again. Communication goes both ways between the provider, the dental care provider, and the family. Try to get any health history paperwork completed and returned to your dental provider as soon as possible before the visit. Getting this paperwork ahead of time versus while sitting in the dental office allows you the time to go through the material carefully and with attention to details, and it allows the dentist to consider any issues that might arise in that paperwork that he needs to investigate. Notify the dental office ahead of the visit, several days if possible, if you need special communication accommodations like American Sign Language interpreters. Any care instructions that the dentist gives to you or the child should be given verbally and in a written form that's something that you can understand without a lot of technical words. Do not be afraid to ask them if you do not understand, or if you feel like maybe the instructions that you're given by the office would not work with your family. Go over it and make sure you know who to call in case you have questions before you ever leave the office. Let's look at other supports for communications. With regard to hearing aids and cochlear implants, notice that the background noise can make it harder for communications and hard to understand the dental providers, especially when the office uses a large open bay. Let the staff know this, and together you can both anticipate and overcome any potential communication barriers. Also, consider using alternative strategies as needed, like using a computer monitor, a tablet, or visual aids. I like to use a dry erase board. The use of a model of teeth to facilitate asking questions or explanations is useful as well. A pain scale using pictures is yet another tool to consider to help both parties increase their understanding. Due to COVID-19, families may need to bring their own pad or tablet or their handheld whiteboard or paper or pencils to write notes. It's great to plan ahead. Share and request the types of support strategies that work best for your child before your visit, and allow enough time for those to be accomplished. Both the office and you need to be prepared so that you feel confident in advocating for your needs. Just as we discussed the need to decrease anxiety and have an established code or phrase to use between you and your child, you also need to have that code or phrase to use between the dental team in case you need to understand something better and you don't want your child to hear. Watch your child closely for body language, and even consider a special code word between the two of you, as we discussed earlier. If more discussion about what needs to be done needs to occur, step outside the operatory with the dentist ahead of time and let him know that you need more information. One of the things that I really enjoy, one of my children has a hearing problem, is the clear window mask. These are not appropriate due to COVID for your dental provider to wear, but it's great for a parent to wear, because if your child reads lips, they can see your mouth, or just a smile is one of the most reassuring things a parent can give to their child. Later on, we're going to be giving you some information about where you can get some of these little devices that we'll talk about with you today. You're muted, Allie.
Thank you, Debbie. I apologize. This is Allie. Our next category today is going to be sensory concerns. Similar to the anxiety category, a private exam room can aid in minimizing sensory overload. Your child would be less likely to hear surrounding noises, sounds, or even comments coming from other patients. Behavioral support options or choices can be used to further ensure a safe environment for the child and staff. In some of the more advanced situations, restraints may be considered necessary for the protection of your child. Using an in-office restraint may be preferred to giving anesthesia or to having to take a trip to the operating room for care. Before any behavioral support or restraining options are used, parents must give informed consent. It's important to keep in mind that you'll want to read any paperwork regarding informed consent before signing. Sometimes that consent can come in the new patient paperwork or something with real fine print. So you'll want to be sure that you actually read that through so you can know what you are signing. You may want to consider sunglasses. This can help with sensitivity to lights. In addition, it can also protect your child's eye from an injury or just their own saliva splashing back in their eye, right? That's something that my kids freak out over. You may want to consider bringing your child's own pair of sunglasses, or maybe just having a special pair that you keep around to bring to appointments. Some children are quite sensitive to those fluorescent lights above. You can ask if there are any options to dim them, if they have any lamp lights or possibly natural light from windows that they can use instead. You can also ask the providers to let your child know in advance when they're going to make changes in the lighting, if they're going to turn on a new light or turn off a light. This warning can help a child gain trust and confidence in the process, since they'll be expecting it instead of startled. For auditory sensitivities, you may want to consider bringing headphones. The noise canceling ones are great, or even if it's just headphones to play some enjoyable music that can kind of drown out some of those background sounds. You can also ask the provider to give warnings before turning on loud, noisy instruments. Similar to the touch, show, and go method, you could also consider asking the provider to describe the dental instruments being used and what purpose they serve. And that may help alleviate anxiety and reduce sensory defensiveness. Hearing the noise when they know it's coming can be a little less, how do I put it? A little less overwhelming, right? If they're expecting it. So. And do you remember how earlier I said that there might be some overlap between categories? Our next slide is probably the perfect example of that. A lot of the same strategies can be discussed in regards to anxiety and communication, and it could also be used for sensory concerns. With regards to sensitivity, like to touch, and for teaching boundaries and consent, it's okay to request that your provider asks permission from your child before touching them. Remember, unexpected touching or patting a child's arm could be an anxiety or a sensory trigger. Within a dental home, you want to seek trust, confidence, and a good working relationship. Also, remember, strategies and accommodations may need to be tweaked and changed as your child grows and matures. What worked for them a couple years ago at their visit may not work now, and that's okay. Just consider each visit a learning opportunity and go with the flow. You may want to encourage the staff to give clear explanations, such as, we're going to wear a bib today to protect our clothes, or we're going to be cleaning your teeth with this special brush. As noted for anxiety, when using familiar and pleasant words to describe the dental exam process. We recommend this tell, show, do approach, like I had mentioned earlier. With this approach, the provider should first tell the child what they're about to do, then show the child what the instrument does, and then do the procedure. See if you can take an item home with you to practice with your child. You may want to have them practice on a doll or a set of teeth at home. I just saw this awesome set of teeth at Target in the toy aisle, and it was a pretend dentist office. And it was a little set. It was about $20, and it had all of the dental tools. I was so amazed. But I've also seen, like on Pinterest, where people will create a little mouth using construction paper and marshmallows, and the marshmallows are the teeth. And so even just doing something like that may help them become familiar, and it can help reduce some of the overstimulation. I just see the comment real quick here from Patricia. I love that. You have your son lay back in the recliner all the way. That is so perfect. I love it. That is a great idea. Okay, so now the same items that we originally noted for anxiety are also relevant for sensory concerns. Consider bringing useful items from home, such as a fidget or a compression clothing. Keep in mind that a weighted blanket or compression vest might not be okay right now when we were talking about those germ protocols, but know what works best at home and have that conversation with your provider so we can see if it works at the dentist's office too. At the very least, this may be a conversation starter that might bring you on to other accommodations and yield good results for everyone. Movement and balance sensitivities can be related to the brain processes and the sensory information that controls their balance. Your child may also be more prone to dizziness. Therefore, you may need to prepare the office by offering seating options. So for instance, does your child want to sit in the chair before or after they recline it? Sometimes it can be a little unsettling if the child is sitting up and then suddenly goes backwards without realizing, right? You'll want to use an explanation that you know that your child understands and will respond to comfortably. Office protocols now may limit alternative seating options, but you can still ask if there is an option to allow your child to gain confidence and so they can be in control. Parents can also model sitting in the exam chair, jump in there quick, as everybody's getting settled, and show your child how you are comfortable in the chair, and that might go a long way. In some situations, it may be a better option for your child to remain in their mobility chair if they have one. Many mobility chairs now will allow for various reclining positions, which the dentist may be able to still work with. Plus, remaining in the chair may minimize anxiety because it's something familiar and comfortable for your child. We'll address some of the other benefits of remaining in the mobility chair a little bit later on. Something that we used to do actually in our family is I would sit in the exam chair and my child would sit in my lap. And so I'd be able to kind of hug them from behind and provide that sensory stimulation that they were needing, and they felt comfortable and safe, and it was a breeze after we figured that out. I encourage you to advocate on behalf of your child so that way you can be a role model for building trusting relationships and maintaining a sense of control of their bodies and honoring their needs. As your child gets older, we hope that they'll begin to learn how to advocate for themselves as much as possible too. So here are some examples of what the dental care team can do directly to minimize sensory sensitivities. They can give the option to rinse with water from a cup instead of the little tool that shoots the water in the mouth. Sorry, Debbie, I know you're going to be mad. I forgot the name of it. I apologize. But you know the tool I'm talking about, right?
The air water syringe.
Thank you. So some kids just do not do well with that at all. So you can ask if they can provide a cup instead. Yeah, no, Mr. Thirsty sucks it up, doesn't it, Christy? Sorry, I see Christy's comment.
Yes.
But so, yes, so, that can be one option. So that way they have control over how much water goes in the mouth and then they can spit it out. Dental providers can also use alternatives to cotton-related products, such as to keep the mouth more dry during the procedure. However, many dental procedures are technique sensitive and it might not be able to be adjusted. Moisture is the most common reason for a failure of a procedure. So suction and air may be unavoidable tools, but it's worth a discussion to see if the procedure can still be done. You can also ask your provider to avoid air fresheners or synthetic fragrances, essential oils, perfume or cologne, scented lotions, things like this, if you know that your child has a sensitivity to it. Remember, you can always ask for support of your choices or options. However, you want to keep in mind that compromise is often necessary. That way they can meet regulated policies to receive effective services and to develop and maintain a positive relationship between your family and the provider.
Hi, this is Debbie again. I would just like to repeat what Allie has said. These are all great suggestions and at the end, we'll talk a little bit more about some of them, but do realize that some of the techniques are really sensitive to moisture and positioning, and they may not be possible. That doesn't mean that you can't ask for them, but just keep in mind that sometimes dental offices provide the service in a certain way for a good reason. So let's continue on with our checklist. We've talked about strategies to address anxiety, communication, and sensory concerns. But let's look at the last group, mobility concerns. Remember, accessibility is more than outdoor parking spaces. Accessibility includes being able to move freely around the office. Does the exam room allow the person who might be in a wheelchair or on a walker or with crutches to move around? Does the armchair lift up? These are all questions you can ask. This checklist is for you when you call and make the appointment so that you can get this information out there before you arrive. Does the exam room have enough space so that your child can move safely from their mobility device to the chair? Or is their exam room designed and your child's mobility device designed so that there's no need for the patient to transfer? Just as we've mentioned about sensory concerns, there are benefits of having a child remain in their mobility chair. Many of the mobility chairs now do recline. They've got the side panels next to the head to keep the head immobile and keep the staff safe as well as your child. Remaining in the chair prevents a stress of transfer and any stability straps and harnesses that would offer additional security and comfort may not be on the dental chair that are on the mobility device. Letting the child be able to stay in the chair allows him, in his own mobility chair, allows him to stay where he's comfortable. It's like spending the night at home in your own bed versus being in a strange place. Please know, beyond what's normally used with the mobility chair, the use of restraints referred to as positive stabilization or a papoose board, as well as sedation, anesthesia, require the parent's written informed consent, as Allie said earlier, and you must sign for that. I recently took a course with an occupational therapist that even talked about pressure, and we'll talk about that later with children who may have cerebral palsy or other conditions that might invoke a seizure. Appropriate chair angle with the dental chair is also important. Your child may not like to go all the way back, but sometimes there are reasons they need to go back. Other times there are reasons they can't go all the way back because we want to reduce the risk of aspiration or them breathing something into their lungs that we're using in their mouth that shouldn't be in their lungs. A roll-up towel can help. I like to use pool noodles. I even like to use the husband pillows, the triangular pillows with arms, because the arms help to keep the child stable. Again, using a cup of water instead of the air water syringe. I've been in dentistry for 53 years and we didn't always have the air water syringe. So it's okay to ask your office to try to be a little agile and working with your child, but remember that sometimes there are reasons that they can't accept your suggestions. One of the things that I really advocate for is a mouth prop. There are mouth props that are very inexpensive and that you can get, that you can give to the child to take home. The most common concept or complaint that I hear from parents is that they can't brush the child's teeth because they won't open their mouth. Well, if you're using this in a dental office and you get to take it home with you, you can use it at home. It's dishwasher safe, so you can even use it between children. It's soft, it feels like a hard, almost styrofoam, and the children can just rest their mouth on it. So it actually makes it easier, particularly if you have a child who tends to have muscle spasms or doesn't have good relaxation. And it makes it easier for both the provider and the child. The last two questions on the checklist, I feel, are really the two most important. You need to make sure that before you establish a dental home, that you understand if they accept your insurance or your method for paying. After COVID, some people lost their jobs, so they may not have the same dental insurance, or they may have gotten a new job that has different dental insurance. So find that out before you go through all these questions, 17 questions, to ask for all these accommodations when that's not an office that you're going to be able to frequent. The last question, I think, is also just as important. We want your child to have a dental home that is close to your residence. Accidents happen on weekends. Accidents happen on Christmas morning. You may be taking your child across the state to a dental school. But if they fall on Christmas morning, and I'm from the mountains, and we call it busting your mouth on Christmas morning, which is a very non-technical term, and your dentist is 100 miles away, who are you going to call? So if you have a dental home who knows you, that your whole family goes to that practice, they're going to be available for you to call in case of accidents on holidays or nights or weekends. And they may not see your child, but they'll have knowledge and colleagues in the community who may be able to see your child so that a traumatic event is averted.
You know, Debbie, I think you made a great point on both of those. I just want to maybe add one thing, because I do see it a lot with families that I work with. In terms of the office accepting your insurance, it is super important to know that those families that are now on standard care plans with managed care in Medicaid transformation, that the dental services are actually a carve-out program. And so when you go to the dentist, they will be billing Medicaid directly, opposed to billing one of the plans such as Healthy Blue, WellCare, and other plans of the like. So if you call an office and you say, oh, I have Healthy Blue, and they say, we don't accept it, you know, that may end up turning some people away, and they don't realize that you'll want to let them know that you have North Carolina Medicaid, so that way they can bill. Just because I know that's common confusion.
Yes.
So I want to be sure to add that in here.
This is Debbie again. Thank you, Allie. That is so true. Those of you who may have Medicaid and the new transition to a provider are very familiar with Medicaid, and very often the dental practice may not even be familiar with the transitions that we have made. And so if they say they don't take the insurance plan that you say to start with, please point out to them that it is Medicaid, because they may not know. Thank you, Allie, for bringing
Yes.
that in.
Yes, no, of course. I see it far too often, and you know, we're still early in the transformation. So I think it's one of
Yes.
those bumps that have to be worked out. But later on in the next few slides, we're also going to share the database of providers. And so that will help to clarify as well.
Good, thank you.
So now this is Allie. And so now we do move on to the resource portion of our presentation today. And we're going to discuss some resources for you. First, I would like to suggest, you know, you may want to take a picture of this slide, but again, Christy will be emailing it out afterwards. This is the helpline for children and youth with special health care needs for the state of North Carolina. The helpline is a free information source for caregivers and professionals who care for children and youth birth to age 21 with special needs. This helpline is not just for oral health care concerns, but it can be of assistance. This helpline really is for talking or emailing someone specific about specific health needs related to your child and help you locate resources in your local community and throughout the state. The North Carolina Children with Special, The North Carolina Children with Special Health Needs website and its content was developed by our division along with the branch family partners. It provides key categories of resources that are available on a statewide basis. For example, it offers family support resources, transition to adulthood information, and also includes an alphabetized listing of health explanations. We've already reviewed most of the checklist items in this presentation. Again, you'll be given a copy so you can keep it, either print it out or save a digital copy, and you can use it with your dental provider. Keep in mind, not every strategy will be available, or there may be some you'd have to modify. It really just depends on your child's age and needs. What strategies you used when your child was 6 may no longer be relevant when they're 13. So it's good to keep this on hand so you can go over it every once in a while.
This is Debbie again. Many of you may not be aware, but the North Carolina Department of Public Health has a state public health dental hygienist in every single county of North Carolina. When you get your printout of this presentation, if you will go to that link, it will give you the information on how to contact the state public health dental hygienist in your county. That person will be a wealth of information for you. They know your county. They know who accepts Medicaid. They know which particular practices may be more friendly to seeing children with special health care needs. They may have fact sheets or educational materials that you can use. They'll know about low income clinics, maybe with sliding fee scales, if your family doesn't have dental insurance. One of the other services that they provide is a link to toothtalk.org. And I would strongly suggest that you go in and go through the different programs on that toothtalk.org. It's like a YouTube of wonderfully educational materials. One that I would especially recommend that you look at is the one on silver diamine fluoride. It's one that a lot of dental offices are not even aware of yet. And it is now legally available for pediatricians or physician offices to use. This is a method for arresting tooth decay. It doesn't restore the tooth, but it arrests the tooth decay and buys you a little more time without them ever even getting in a dental chair. There's no shots, there's no drilling, but it does arrest the tooth decay, and it's very inexpensive. It is really a lifesaver, and it may prevent your child from having general anesthesia and going to the operating room. We also have a link for you here of the Medicaid providers and dentists that we know of who accept Medicaid in your county, which your public health dental hygienist is going to know as well. Remember that because a dentist accepts Medicaid, they may not be accepting new patients at this time, but at least it will give you a list that you can start from. Some other oral health resources that we have vetted, we've gone through these links and made sure that they work, that will give you information for you and your family. You can Google this and I'll tell you, you will get thousands of hits. These are 4 particular websites you can go to that we have vetted that provide accurate, scientifically accurate information for you to help with whatever problems you may be dealing with in your family. We also are going to give you some product resources. The first, of course, would be the silver diamine fluoride, which is just amazing. It's applied with a micro Q-tip. The tooth just gets dried, and you don't have to use the air water syringe that Allie was saying so many children despise. You can just take a cotton roll and dab it dry. You hold it on the tooth and you sing the ABC song twice, and the tooth decay is arrested. If your child doesn't like the grit or the taste when they get their teeth cleaned, the hygienist is using something called a prophy angle. There are prophy angles available that have no taste, no grit, so that a child who may have a choking problem, a sensory issue with either the flavor or the grit, it's a great tool for cleaning teeth for children with sensory issues. Xylitol is an artificial sugar that's in some chewing gum and mints, and you can even buy it to use as a sugar substitute. And it kills the two bacteria that kill tooth decay and gum disease. Remember, we said earlier that oral health involves the whole mouth, not just the gums, not just the teeth, but the gums are just as important. The only thing is, if you have pets in your household, xylitol will kill your pets. So make sure you keep it up where they can't get to it. We've already discussed the clear window mask. I love these, and my daughter depended on them during COVID so that she could talk to the checkout lady in the grocery store. The mouth props are great. They're inexpensive. We'll tell you how to get in touch with them to order some for your family or for your dentist, and some teaching aids, some social stories for going to the dental office, for brushing your teeth at home. There are a lot of resources, and I would add to those resources that if you're a dentist that you take your rest of your family to, but who doesn't feel comfortable seeing your child, the North Carolina division that I represent offers free training to offices who may have graduated, where the dentist or some of the staff may have graduated prior to 2020, to help them feel more comfortable in seeing your child. This is Debbie again. The Americans with Disabilities Act is a civil rights law that requires that people who have any kind of disability or differing ability have full and equal access, and that law applies to dental offices. Most children as well as adults are protected under the Americans with Disabilities Act. Dental offices are indeed covered by the Americans with Disabilities Act. Some dentists may not be aware of that. You might want to casually and friendly remind them that this is true for them as well. We have listed for you some websites as well on the Americans with Disabilities Act, and these are also websites that we have checked. We make sure the link works. We've made sure the information that's there is accurate, and you can depend on it if you go to that website. Again, if you just Google Americans with Disabilities Act, you're going to get lots of answers. We also would like for you to fill out a training evaluation. We want to help you do that, and Christy's going to provide that to you after we finish today.
This is Allie. So Debbie had just mentioned the Americans with Disabilities Act. So we're going to talk really briefly about the service animals and the ADA. And so a service animal takes the place of a skill or task that the individual is not able to perform at a level necessary for an activity required for daily living. As one family member has described it to me, she thinks of it like, she said, think of the service animal as durable medical equipment, only with 4 legs and fur. They help to take the place of typical functions or tasks that individuals may need ongoing assistance with. Service animals can also be considered as assistive technology. For example, one that may help a child with self-regulation functions. I know in the epilepsy world, there are a lot of families with seizure alert dogs, and things of that nature. And so, it's important to know that emotional support animals are not protected by the Americans with Disabilities Act in the same way that service animals are. So therefore, offices may limit the ability to bring an emotional support animal with you to the visit. So when it comes to service animals, the institution, in this case, the dental office, may only ask 2 questions. And the first one is this a service animal? And the second one is, what task does it perform? They're not required, they cannot ask about a person's disability or ability. Since this is a dental provider, they may ask about your child's health needs, of course, how it pertains to their oral health care. But overall, they're not allowed to ask about a person's disability or ability, and they may not require documentation for the animal. You cannot ask to have the service animal removed unless the animal is out of control and the handler does not take action, or if the animal is not housebroken. So having both a medical and dental home really is essential for your child's overall health and their general well-being. We hope this presentation has shown you why having access to a regular dental care team that really knows your child, why it's so important. Children with higher health needs may be at a greater risk for oral health concerns. Therefore, further emphasizing the importance of a dental home earlier rather than later in your child's life may be helpful. We reviewed various resources that can support you as a parent or caregiver, but also that your dental practice can be helped with. We have the dental home checklist, the examples for accommodations, in addition with how the Americans with Disabilities Act provides legal protections for children and youth with special health care needs, so they can obtain equal access to public spaces, including getting their dental care services. Parents and caregivers can play a key role in partnering with their dental home, so that way they can ensure a positive dental health experience for all and a great lifetime experience for healthy smiles in their children.
I hope you've learned some few tips today. And if you're interested in having your family dentist be trained, again, I will say that this training is available and it's free to the office. We do want to make this important information available to you, but we want to make sure that we cover all the areas that are great for you. So if you could fill out our evaluation here, it will help us to make sure that we cover all the needs that you were looking for information about today. Obviously, we can't be specific on every single problem, but we want to cover what's important to you.
Okay, and so, we're going to have a quick Q&A session here in just a moment. But, if you think of something later on, or if you don't have a chance to ask it, you can always contact Debbie with questions, and her email is here on the screen. It's DEBBYER@dhs.nc.gov.
This is Debbie again. Thank you, Allie. Does anybody have any questions? I'm happy to take some questions now if some have come to mind while you were listening to us.
Yeah, I think we do have a couple questions in the Q&A. And I did want to go ahead and say, let's see. I think we are going to share a link to that evaluation that you guys need done in the follow-up information, or Lauren, if you want to post that in the chat so people can start answering that now. Real quick plug. So I have a quick poll that I'm going to launch. It'll show up on your screen. It's a quick 3-question evaluation poll. And the reason why these evaluations are so important, and I know people are like, oh my gosh, another evaluation. both of our organizations and agencies are funded by grants, and grants require that we report data on our activities and what we do so we can continue to receive funding to provide training and resources and materials to people in North Carolina for free. So if you would just take a second, we really do use all of this data, and we really appreciate you taking a few seconds to share this. To fill this out. Thank you so much. With that, we'll move over to the Q&A. And we have one question here. Let's see. Is there a list of providers that work with children with sensory needs here in town? And when I asked where this person lived, they said Texas. So, or I believe they meant Texas. They put TX. So, and if that means something else, please let me know. I'm assuming it means Texas. Do either one of you have any ideas how somebody from Texas can find out about dentists in their area?
I would suggest that they contact the Department of the Texas State Department of Public Health. Public Health has a lot of resources that a lot of folks may not be aware of, but they would be the best resource for finding help for people in that particular geographic area. This is Debbie speaking now. And that's why I suggested your public health dental hygienist here in North Carolina, because I know in North Carolina, each county has one, and she is truly the expert on the care providers in that county.
Okay, thank you. Tiffany, I see that it said the evaluation poll wouldn't let you hit submit. I am so sorry. I don't know what's up with that. Don't worry about it. We will send a link in the follow-up email as well, but thanks for letting us know. All right, Jamie has, oh, she got it. Okay. Jamie has a couple of questions. Let's see here. Does Medicaid disability cover dental? I guess meaning SSI if somebody has SSI.
Yes. Now, Medicaid disability does. Medicare disability does not.
Okay, thank you for that distinction.
Just as this is Debbie speaking again, just as people tend to get Medicare and Medicaid confused. Medicaid is a state program. Medicare is the federal program that deals with the aged and the disabled. Medicare itself does not cover dental benefits. However, if you have a Medicare supplement, the Medicaid supplement may cover dental benefits. Sometimes that's a little confusing.
Okay, thank you. Jamie's second question, Philip, I'll come back to your comments, but Jamie's second question was, the dentists that take my child's private dental insurance said that, I'm assuming she meant said that they could not accommodate his disability. I ended up having to take my child to a dentist that doesn't take any insurance and had to pay out of pocket. If Medicaid does indeed cover dental, would I be able to ask the dentist office that treated him to bill Medicaid?
This is Debbie again. You can ask, but they don't have to. That's something that typically is arranged in advance. If you will contact Medicaid, Medicaid has a long list of dentists who can accommodate children with special health care needs and do accept Medicaid. I would also, shameless promotion here, if that office doesn't feel comfortable providing care, remember that there are free courses that we offer to local dental practices to train them to feel more comfortable providing care to that child.
And the link to the list of dentists that take Medicaid
will be in the
will be
handout.
shared. Yes.
And this is Allie. If I could just make one other point as well, how Debbie had mentioned reaching out to your county's dental hygienist. This may be one of those instances where it may be very helpful, because I do know of some offices that do not accept Medicaid for their general patient base, I guess you would call it. But if your child has special health needs that requires a specialist to work on them, there may be a way to kind of get them in there as well. So really, you know, on a county level, I think they would maybe be the best ones to kind of answer that question with local offices.
Great. Thank you, Allie. Okay, let's see. Philip said, I had a friend with cerebral palsy who got sedated whenever we went to the dentist. Is it possible that sedation dentistry is not necessary if there are providers who are better trained to work with people with IDD?
This is Debbie again. Yes, we just took a course with occupational therapists, and the key thing, of course, it depends on what, again, it all depends on the procedure that they're doing. But very often, folks with cerebral palsy muscles are in a tonic state, and that makes it hard to get their mouth open and or to work on them. So traditionally, dentists have just put them to sleep and done it. However, occupational therapy is now teaching dentists that to control the lips, to control the hips. And we teach methods in our course to get their hips comfortable in the chair. And if you start with the large muscles and get their legs comfortable and relaxed, you will see that that will continue up the body to the arms and to the mouth. It's also possible, when we were talking about touching the child and asking permission to touch the child, that occupational therapy will tell you that a firm touch triggers the sensory system that says comfort and relaxation, and it helps them to relax. So if you can have a parent or a family member put firm pressure on a patient's leg or thigh, it's something the dental professional may not feel comfortable doing, but if the parent will do it, and or their upper arm or shoulder, it will help them to relax. And then that will extend to their mouth to where they can get in and do more work, again, depending on the procedure. And again, that's when a mouth prop would be wonderful, because that tonic state would be relieved by the mouth prop being in there. By the same token, a light touch, or what we may consider to be soothing by lightly rubbing on the hand, promotes a different a different sensory system that stimulates pain and may cause them to become more tonic and not be able to do it, which is why, and says nothing about the dentist or the dentists that are taking people to the operating room. We just weren't trained in this kind of stuff before 2020, unless they are a pediatric dentist. Pediatric dentists were trained in all this, but your general on the corner dentist just didn't get this training. But we do know through occupational therapy ways that we can provide that dental home to folks with cerebral palsy. And again, it just is something that has to be learned and done individually. And it depends again on the individual and on the procedure that they're having done. But there are ways to get around going to the nursing home. This is another case that until they can manage that tonic condition of the muscles, the silver diamine fluoride would be a great alternative, particularly if the patient doesn't have the resources to be able to afford to go to the operating room every time they need to have something done. Great question, Philip.
Yeah, thank you, Debbie. This is Christy. And just to follow up from Philip, he just said, in other words, might some dentists be unnecessarily sedating people with IDD when they can use other methods to effectively provide dental care to the patient? And I believe, you answered that already, but if you have any other comments.
You always have the option of a second opinion. This is Debbie again.
And this is Allie. I do know that we have had really wonderful dental experiences, and we have had some not so wonderful dental experiences in our family. Sometimes we found for us, it was maybe not time to kind of see what else was out there in terms of maybe a second opinion and someone that, really had better accommodations in place for us. And I know in the past, there were times where they have wanted to sedate my children. But then we've decided to, let's try this first. And if this doesn't work, then we'll go on to sedation. And more often than not, it ended up working. And so we didn't have to go there, right? And so I think it's on an individual case-by-case basis. That's not always possible. But it is worth having the discussion and possibly trying something first and then moving on when possible.
This is Debbie again. Besides my consulting job with the state, I also work in a local pediatric practice, and we do take children to the operating room 2 days a week. But taking children to the operating room is a last resort because there are risks associated with general anesthesia. However, you also don't want to traumatize the child if it's a young child. Sometimes if you traumatize a child who's 3, 4 years old, for life, they're always going to be nervous about the dentist, which is one reason I'm such a huge, huge fan of the silver diamine fluoride. It's literally like when I was little and we got a boo-boo, my mom put mercurochrome on your knee instead of us going to the emergency room. We know now that that wasn't the best option, but at the time it was a good alternative to run into the emergency room every time you got a boo-boo on your knee. And silver diamine fluoride is very similar without all the risk in that it's not the total answer and it doesn't restore the tooth, but it can buy you some time until alternative methods and education and science can catch up to the need that we have in the community.
That's a great point, Debbie. I'm glad that you made it. Thank you, because I failed to mention that. Trauma can be big, right? And so we want to make sure that, we're not causing more harm than good, right?
Thank you, ladies. This is Christy. Let's see. Sharmika has a question. How would I get a child with facial paralysis ready for the dentist? Great question.
This is Debbie again. That is a great question. Speech therapist, if your child also goes to a speech therapist, which I would think they probably do if they have facial paralysis, use a vibrator to teach the muscles in the face to relax. You can start that process by letting your child use a sonic or electric toothbrush at home. It provides that same stimulation to the muscles. It's just providing it to the inside of the cheek instead of the outside of the cheek. There are also some muscle relaxers that your dentist can give to the child that will help them to relax. You may have already tried that, but it needs to be done only by prescription and with a medical provider and signed informed consent. But yes, they can still go to the dentist, but that if you can start the process at home by using that electric toothbrush and or sonic toothbrush, because just the vibrations teach your muscles to relax. Now they may not, particularly if they also have some sensory concerns, may not be totally comfortable with that. So if your sonic or your sonic toothbrush has settings, go to the lowest setting and start by letting them feel that on the palm of their hand in a very firm manner. Again, not on the back of the hand with a light manner, but it's just like with the cerebral palsy, because that light vibration can be perceived as pain, whereas the firm vibration on the palm of the hand is like having a massage, for lack of a better analogy to it. But yes, they still can have dental care, and you can start preparing them for that at home.
Thank you, Debbie. This is Christy again. And I see we have some good comments and questions popping up in the chat, and I'll get to those in just a second after I finish with the Q&A. Sharmika's follow-up to that was, my daughter has a texture sensitivity and facial paralysis. She holds her mouth tight. She has already had a lip and tongue division, but brushing her teeth is a fight. And what could I do to help her enjoy brushing?
There are, number one is get her ready with the sonic toothbrush. If she's not comfortable with the sonic toothbrush yet, go ahead and start with the palm of the hand. But there is another type of toothbrush called a surround toothbrush that brushes the cheek side, the tongue side, and the chewing side of the tooth all at one time. So it cuts the time that you spend brushing her teeth by 2/3 because you're just going in each arch one time. Remember that the only reason we use toothpaste is for the fluoride in it. Toothpaste does nothing to clean the teeth. If she doesn't like the flavor of the toothpaste, if she doesn't like the texture of the toothpaste, that's fine. You can get mouthwash that contains no alcohol, but that has fluoride in it. Dip the toothbrush in the mouthwash, not to have her gargle with it, but to get the toothbrush wet. And then as you go around her teeth with that toothbrush, that fluoride will still be in contact with the tooth to prevent decay. There's also a type of toothpaste called Aura Nurse, ORANURSE. You can get it on Amazon. It actually has higher than your normal Crest or Colgate or Arm & Hammer fluoride in it, but it has no taste and no texture. And it's designed specifically for children with autism or other sensory problems. And if you can take baby steps, maybe just get her use that surround toothbrush, and you can get a surround toothbrush on Amazon as well. I would get the adult version, even if she's a child. The reason you want the adult version is the handle is longer, so you don't have your fist right up against her face, which is kind of threatening if you think about it. And you can also put her hand on the toothbrush as well as yours. It'll make it go quicker and easier. And once she sees that you're getting in there and it's quick and it's easy, I think you'll have greater success. It also helps to do it in steps. We're going to put the toothbrush in your mouth. We're going to do this side and this side and this side and this side, and we're going to be through. It helps a whole lot, particularly with children with IDD, to know that things come in step. Think of first and then and then and then. But if they don't like toothpaste, don't use it. Get you some, I hate to use brand names, but a brand name is Listerine Free Total. Use a mouthwash that doesn't have alcohol, but it does have fluoride, and that particular brand does. Any brand is fine as long as it doesn't have alcohol, but it does have fluoride. And don't let them gargle with it. We don't want them to choke, but just dip the toothbrush down in it so that they're just brushing with like a wet toothbrush. And I think if you're using, and you can graduate her with the vibrations, and the speech and occupational therapist can help with that as well, I think you're going to be very pleased within 6 to 8 months at the results that you'll see.
Thank you, Debbie. This is Christy. Those were great recommendations. I love hearing about all, my daughter has taste and texture aversion. So every time Debbie says something about that, I'm like, oh, write that down. We have about 5 minutes left. Patricia has a question. She says, my son's dentist for 10 years. He makes him come in early before they open and be in a separate room, when usually it's an open floor concept. He says his screaming scares the other children. I've tried to work with him, but I feel it's also time for a second opinion. Do either one of you have a comment about that?
This is Debbie again. I agree with the dentist, and it's better for the child if he's nervous or screaming to be in there where he doesn't have the other distractions, the other noises, the other smells. And that dentist is actually doing you a favor by doing that, because let's face it, dentistry is a business, and they calculate how much they need to make every hour for every chair and every member of personnel that they have there. So by bringing him in early, he's giving him the benefit of the lack of sensory stimulation. And other than taking him to the operating room, I don't know of any other way to protect him from that. So in this case, I'm going to have to agree with the dentist. Allie, you may have a different opinion.
So just kind of as a family member, I think that, really having trust and a good working relationship with your provider is so, so important. And so if there may be other things that you're uncomfortable with, or if there's something where you feel that there's maybe a division between you and the provider, it may be helpful to seek a second opinion. It may not be, but I do believe that you really, trust and two-way communication goes a long way, right? So I
I
think
agree.
that's probably all I can, say on that really, but you want to be able to have a good relationship. That really is priceless. Debbie, before I forget, you had mentioned the mouth props earlier. Where is
Yes.
it that parents can find that?
There, we have a resource list that we will send out, but they are available, again, on Amazon. And that link is in our resources list. And if we come and do an in-person session for your group, and we will come statewide, if you have a group in your local community of other parents who may have children with special health care needs, we will come and do a workshop for them. And everybody laughs because I bring my wagon. I have a wagon, literally a wagon that I bring with mouth props and masks and various kinds of toothbrushes and medicaments for people to try, because everything doesn't work for everybody. If it did, we'd all wear the same makeup and mascara and everything else. But it's good to have your care individualized to your child, whether it's in your bathroom at home or in your dental office. So we'll come and do a class for your group, or we'll come and do a class for your dentist, and we're happy to do it. And it's all free, but you can get those on Amazon. And I think they're like around $1. They may even be less than $1, but it's a great investment in your child's dental health and your sanity.
Thank you, Debbie. This is Christy. I just wanted to rise up two things that Carrie said in the chat. She said dentist websites regarding accepted insurance is not always up to date.
True.
The idea to call dentists and check with them directly. Absolutely. We run into that. And also dentist websites often can be a great source of photos of the rooms and people who your child will meet. And my daughter has tremendous anxiety, my youngest one. And that's one thing that was great, being able to, once she got to see a picture or a place, even in photos, it brought a sense of familiarity. And I would show her pictures of the hygienist, the dentist, what the room looked like. There are some dentists who actually have social stories on their websites for kids with disabilities, using the pictures of their actual practice. And I have some examples of those in a presentation that I do with my 12-year-old daughter for the dental school. But yeah, no, great. As much as you can do to kind of get that whole thing familiar is super helpful. Let's see if I can bring up one more thing before we go. Oh, let's see. Scrolling in a small window. Okay. How does one answer to an office denial for accommodations? I know you mentioned bringing it up nicely, but how does one respond to that?
You can just, this is Debbie again, just let them know that under the Americans with Disabilities Act, they have to provide an adequate accommodation, or provide you in writing why they cannot, and refer you to someone who can. In other words, if they do silver fillings on every other patient in their office, but they won't do a silver filling on your child, that's an example of when they would have to write a written explanation to you and provide you with a referral to someone who can. If they don't do extractions, but your child needs an extraction, that would be a justifiable reason for them to refuse that service to you, if that makes sense.
Thank you, Debbie. All right, we are actually after time. I apologize for running a little bit over. I would like to thank our presenters today, Debbie and Allie, for sharing all this great information with us. Thank you, ladies, so much. And Lauren Howard for running the show, and our interpreters and our closed captioners. Thank you, everybody, for coming together to make this presentation possible. Like I said in the beginning, I will send a follow-up email. It's going to take just a little bit to get the recording all ready to go. So if not this afternoon, I'll send it out tomorrow for sure. And we look forward to maybe seeing all of you again at another one of our events. And Debbie, your contact information is in the slides,
Yes,
correct?
please. If you need me, just call me.
And
I'm an
she
old
is
mountain girl. I don't get easily offended. And
that.
Christy will tell you if there's a way I can do it, I certainly will try and make it be done.
She will. She will. Well, thank you everybody for joining us this afternoon, and y'all have a great rest of your day.